of our residents doing the right thing has been instrumental to us getting to where we are today, following public health advice and getting vaccinated being the two principal elements. And all I can say now is, please don't give up. Please don't give up. We're so close to bringing the pandemic to an end. We just have to get through this first step of the safe and cautious reopening successfully, and then we can move on to the second and on from there. And on that optimistic note, I will ask Dr. Davila to offer her remarks for today.
Thank you, Mr. Mayor, and good afternoon. Today, I'm reporting 117 new cases of COVID-19. 706 people are in the hospital. 203 people are in the ICU. I'm saddened to report 12 deaths today. Many are wondering what the Delta variant means for our immediate future, since we're on the verge of entering step one of the province's reopening plan. Torontonians will be able to enjoy some things that we have been missing for so long. In my view, Toronto is on a solid path forward, though a narrow path, while we watch what the Delta variant does here. The Delta variant is a force to be reckoned with. More transmissible, more infectious. We at Toronto Public Health and our partners across the city remain ready to respond quickly should the need arise. And certainly, with the Delta variant here, we will want to do two things in particular. Increase first and second dose vaccine coverage, and proceed selectively in daily life. After all these months, I think most people are inherently cautious. Just because you can do something doesn't mean you have to. In the United Kingdom, pubs reopened with huge enthusiasm and the streets were packed. But then, the number of pub goers pulled back for a while. It's natural for people to test the waters, and it would not be surprising to see the same kind of behavior. Going forward and over time, we have a lot to get used to. Certainly, each next phase or step of the reopening plan occurs only so long as COVID is minimized, so that's a factor to think about and our collective goal over the next several weeks. There are currently 122 confirmed cases of the Delta variant here in Toronto. That may not sound like a lot, but the confirmation process is complex and takes time. And moreover, we've seen what happens when a variant suddenly explodes. The good news is that evidence from other parts of the world proves the vaccines are holding strong against the Delta variant and are continuing to protect people, particularly with 2 doses of vaccine. I often talk about the situation in the United Kingdom because their experience is a good example of the challenges that we may face and the choices before us. Public Health England says Delta is now the dominant strain there, replacing B.1.1.7. Total case counts there jumped 90% in the last week. Their health minister now says the next phase of their reopening, currently set for June 21st, may be delayed. He also said the Delta variant is 40% more transmissible than the B.1.1.7 variant. Providing the basis for cautious optimism, Public Health England produced a study that found that the Pfizer vaccine was 88% effective against symptomatic disease from the Delta variant 2 weeks after the second dose, and that 2 doses of the AstraZeneca vaccine were 60% effective. It also found, and I offer this as a caution for us, that with just 1 dose, Both vaccines were 33% effective against symptomatic disease from the Delta variant. So far, in the UK, over 40 million people have had a first vaccine dose. That's 75% of the adult population. And more than 28 million, or a little over 40%, have had a second. So you can see how the Delta variant can surge. In Toronto, just over 72% of residents over 18 years of age have had one dose of vaccine. Only 11% had two doses. B.1.1.7 is still the dominant variant detected here, another highly transmissible variant that started quietly and then exploded. That was what we saw in the third wave that is now waning. At points during the pandemic, we all worried that Toronto's hospitals would be overwhelmed with COVID-19 cases. We all saw hospital systems, like in Italy and the United States, that collapsed or came close to it because the number of infected people overwhelmed the system. The same number of sick people that can overwhelm a hospital is the same number of people that can overwhelm case and contact management. It's a number of people so big that it requires we switch to major public health measures that limit contact between all people, not just those who are sick and their contacts. Our lowered case count allows Toronto Public Health to deploy case and contact management where we locate and engage with confirmed cases and their contacts. Our ability to reach both categories within 24 hours is high. Between June 2nd and 4th, for example, we successfully reached 97.2% of newly confirmed cases of COVID-19 within this window and 83.7% of newly reported contacts. We are confident we will continue to improve this contact rate as long as the comparatively low number of cases continues. But as with so many other things, a lot is at the mercy of case counts. This is where we each have our part to play. COVID-19 is a nimble virus and doesn't seem ready to go away quickly or easily. We are nearing the finish line. We don't want to turn it into an obstacle course. So please, if you have not made arrangements for your first dose of vaccine, I ask you to do so. When your turn comes to get your second dose, please take it. If you've had a first dose, don't overestimate its protective power. These are two-dose vaccines for a reason. I ask that you please make it your mission to show up for both. The things we hope for this summer are still reasonable hopes. But with variants in the background, our challenge now is not to wait for those things, but to protect them. With that, I'll hand it over to you, Brad, for the questions.
Dr. Davila, we'll go to questions now. Just a reminder to please unmute yourself. We also have a number of senior staff on the line. Chief Peg, should you have them? And we'll go first to David Ryder from the Toronto Star. Dave, go ahead.
Hi there. I'm hoping whoever has the details can give us some more information about this sort of shocking description of racist and abusive behavior of vaccine staff. Is it new? What seems to be prompting it, and what is being done about it?
So I'm not sure if Chief Peg or Mr. Mayor, if you have specifics on that.
To address that, please.
Hi, can you hear me, Brad?
Yes, go ahead, Chief. Thank you.
Hi everyone, Chief Peg here. So this is something, David, that came to our attention formally earlier today. And I don't have any sense with respect to, I would say, the volume of what is going on. But in essence, what this is our staff are continuing to see, and on a somewhat increasingly basis, seeing people that are being increasingly aggressive with respect to things like looking for second doses, and are being increasingly, I would say, aggressive with some of the commentary. And I don't actually have examples of that. It's been provided to me generically at this point, but some commentary with the staff, as well as looking to contravene the rules that we've set in the clinics with respect to things like no photography. And the no photography in the clinics is done for reasons of protecting personal health information. It is the reason that we have never allowed photography other than very controlled circumstances that our strategic communications team facilitates. We've never allowed open photography, and that is because people are entitled to their own personal privacy when they're engaging in vaccine, as our staff are. Many of the nurses and many of the both clinical and non-clinical staff have and continue to express a desire not to be photographed in the performance of their duties. So what has come to me this morning is really focused around, a lot of it seems to be around the desire for photographs and images, and some overly aggressive behavior when they're asked not to do that. But I don't have anything more than that at this point. Oh, I should say what we're doing about it. We're in direct contact, of course, with the staff. Dr. Patty, who is our clinical director, working for Dr. Davila, of course, and our immunization clinic team are on top of this. We're certainly connected, as you heard the mayor made commentary towards it today. So looking to address it proactively from an education standpoint, certainly asking for everyone's continued cooperation and respect for both the staff and the clients in the vaccine clinics. And we will continue to work directly with our staff if it continues, and if something needs to escalate, we'll deal with that as it comes.
Let me just add, Chief, as well, that, Dave, there are, as you know, selfie stations within our clinics, and those are separate and apart from the clinical operation, allow people to share and celebrate their vaccine. That is separate and apart from the issue that the Chief is describing. You have a follow-up, Dave?
Yeah, sorry about that. It's probably for Mayor Tory, and that's with this reopening that we're.
Sorry, Dave, we lost you. Can you try again, please? Just a moment, please. Dave, can you try muting yourself and then unmuting again, maybe? I see you're unmuted, but we're not hearing your question. Hey, Dave, I'll tell you what, we'll come back to you for your follow-up. I appreciate you had one on reopening for the mayor. We'll come back to you. Let's try Greg Ross from CBC. Greg, are you there?
Yeah, I'm here. Can you hear me?
Yes, go ahead, please.
Okay, so my question was also going to be about the reopening. Just talking to some restaurant owners, and I think I'm getting a sense that there's a little bit of confusion on what the guidelines are going to be. Are they going to be exactly the same as they were the last time we had patios? Or, I mean, has anything changed? What are the limits in terms of how many people, spacing, that kind of thing? So is there some clarity? Is there somewhere that restaurant owners can get clarity? And what are those guidelines?
My own information is that the provincial roadmap has very clear guidelines on 4 people per table, that there's an exception to that for extended households, so that if there's a group of 4 that's one household that's bigger, that's allowed. That otherwise each table has to be separated by, I believe it's 2 meters in order to preserve physical distancing. And in that sense, I think it's fairly straightforward. It's only outdoor dining, not indoor. So I don't know beyond that what people are confused about, but certainly if there's information, somebody here will have it. But I think those are the basic core elements of what. No,
I think some of the restaurant owners I was talking to said they just hadn't been given that guidance and it wasn't clear to them, and they were, and there was some discrepancies between one restaurant and the other in terms of how they were spacing tables and that kind of thing, and then concerns over what the enforcement will be on those kinds of things.
Well, the enforcement, and maybe Chief Pegg will want to add to this, the enforcement will be what it's always been, probably largely complaint-driven, and obviously in some of the earlier stages when more things were open, we had officers who would walk by on patrol, as it were, and look for, things that were, serious, violations of the rules. Oftentimes that would be more of a crowd scene of people standing around, which they're not really supposed to do in this early stage. But I think that as far as the lack of clarity on the rules is concerned, people can look at the provincial order, and I think it is actually quite straightforward, and the rules are fairly simple, and they're of universal application, not just in Toronto, but across the province, which I think is a big help compared to previous situations in which we saw differences even within this region as to what people could do or not do. It's outdoor dining, it's 4 to a table. It is more than 4 to a table only in the event those people are part of an extended household plus one caregiver, and it is a distance between tables that is very straightforward.
I'll ask Carleton Grant from Municipal Licensing and Standards to just touch on the enforcement piece. Carleton, are you there?
Yeah, I'm here, and I think the mayor has really said that it is quite clear, and I agree with him. Enforcement, it'll be, again, ourselves, police, and public health. We will be out and about at restaurants to make sure that they are adhering to the distancing rules and the number of people per table. The other key piece with Euro Cup and other things, the hockey playoffs happening, is that it's the restaurant's job, the people, waiting outside the patio or queuing, that the sidewalks and streets don't turn into large gatherings. I know that will be challenging, but it is something that we all need to work together on.
Oh, and if I could just
we're going to go back to Dave Ryder from the Star for his follow-up. Dave, are you there?
Yeah. Was Mayor Tory going to add something to that last one? I'm not sure if he got cut off there. I'll continue with my question. Sorry about the problems.
No, that's fine.
Okay. My question was, this will be the first reopening I think we've had where all of the GTHA are opening up together. How important do you think to have success in putting the pandemic behind us, that all the regions stay with uniform rules, that we don't have indoor dining in York before Toronto or situations like we've had in the past?
It's a very good question. I think it's an important question, and it is one that we discussed at our last meeting of the GTHA mayors, because what I asked of them, and I asked in my capacity as kind of a person who ended up chairing these meetings, is that we stay together on this, because, and it's not because we stay together so that one region won't have an edge on another. It's not about that at all. It's about not confusing the public, making it clear and easy for people to understand what is allowed, what isn't allowed, when it's going to happen, what the conditions will be when it does happen, so that together in this region, where we very much had a regional challenge in dealing with COVID-19, people in government, people in business, and people who are patrons of those restaurants will understand what the rules are. And so we did agree at that meeting, and I realized that was at a meeting on WebEx, and nobody signed anything, but I think we're all very sincere in wanting to make sure that what the province has wisely done, which is to have one set of rules, and it's one set of rules that apply to this region, and for that matter the whole province, remains that way. We don't try to start calling for or implementing anything any different, that we talk to the province and obviously watch all the numbers together, but that we act together so that people will not be confused, and so that it will maximize our chances for success.
Thank you very much. We'll go next to Jane Stevenson from the Toronto Sun. Go ahead, Jane.
So yes, this is for Mayor Tory. Just with regards to the letter sent to the city yesterday from the Church Wellesley BIA calling on the removal of the Alexander Wood statue from the gay village. The city's reaction to that letter and possible response.
Well, two different responses I'll have for you. Number one, with regard to this specific instance, it is the case that the BIA many years ago largely paid for and installed, with the permission of the city, the statue in that location. And the contract between the city and the BIA, which allowed for it to be on that piece of public property, allows for the BIA, the business group, to terminate it whenever they want. In fact, the only people that would have to give any notice if we wanted the statue removed from the sidewalk would be us. We have to give 90 days days' notice. So they're free to remove the statue if that's what they decide to do, especially in light of the fact that they asked for it and paid for the majority of it. On the broader issue, I think this is a good example of how we're going to have to develop, and we expect to have some recommendations from the city manager come the next few weeks. With respect to the general matter of recognition and historical things that arise that may call into question recognition extended to people in the past in this way or other ways. And because you just can't have a situation where other people decide on an ad hoc basis on their own to remove recognition or change things, but nor can you have a situation where there isn't some mechanism to deal with what are often legitimate concerns that have come up in the context of 21st century values or whatever. So we're working on that to make sure it can be done in an orderly fashion, a timely fashion, but knowing as well that there's some obligation to make sure you check the history, check the facts, and that's why you need a process.
And it's just a follow-up then, knowing now that you tell me they can remove it themselves, one of the things they asked is that something replace it, a project that is too spirited advised with the cost shared by Church Wellesley Village BIA and the City of Toronto. So would you be willing to share in the cost of whatever comes up in light of that statue being removed?
Well, I'm very open to discussing that kind of thing because it may be a very suitable thing to have in that location. I don't like to say yes, that I'll agree to a cost when I don't know what the amount is, or yes, I'll agree to a cost or even a concept when I don't know what it is, but I would be open to that. And there would have to be a negotiation because, again, this is a piece of public property. In fact, it was located where I think previously there was just a sidewalk going by. And so we would engage in very good faith in those discussions with the BIA and with the community and do whatever seems reasonable. But we'll take it one step at a time and see what the BIA want to do with this statue and where that goes from there.
Thank you.
Thank you. We'll go next to Kaitlin Lee from 680 News. Kaitlin, go ahead, please.
Sorry, can you hear me? Yeah, I was wondering about the Delta variant. I spoke to a lot of people on the beach this weekend when they opened up, and a lot of people seemed very comfortable because they had a first dose of the COVID vaccine. But obviously we heard with that stat that Dr. Davila brought up that, you know, you're only 33% of protected, I guess, against this variant specifically. Is there a message you'd like to give to people when it comes to getting that second dose and maybe if they should keep their guard up this weekend, especially with patios and things reopening?
Yeah, so thanks for that question. And I think you heard me make these comments or comments of this ilk in my remarks. Certainly we're all pleased to see the numbers and the indicators and our circumstances get to the point where we are able to move to step one of that reopening plan of the province. But of course, there is still need for some caution. We know, however, that there are some things in our favor. We have a number of people, a goodly proportion of our population, over 72% of those 18 years of age and older, with one dose of vaccine on board, and it is summer. So we are able to make better use of the outdoor space where we know the risks of transmission are definitely lower. Not zero, but definitely lower. So again, I would encourage people to, take advantage of the lovely weather outside, use the outdoor space. It's a safer space in respect of COVID-19 transmission. And I would again encourage people to get their vaccine. If you haven't had your first dose yet, please go and get that first dose. And when your turn comes up for that second dose, I would encourage you to absolutely make sure you get that second dose because you're not fully protected until you have that second dose on board. The final thing I will say is I would encourage every Torontonian to ask their network of friends and family, their neighbors, are they vaccinated? And do everything you can to help your friends, your family, your neighbors to get that vaccination. This is how we can best protect ourselves, how we protect our community, and how we continue to restore some of those activities that we've been missing for many, many months now to our city.
Kaitlin?
Yeah, and just a follow-up question about the incidents of harassment at the clinics. I was just wondering, is this just happening inside the clinics, or are there any incidents of people, protesting the vaccinations themselves?
Be able to address that?
Hi, it's Chief Peg. To my knowledge, at least what has come to my attention is these are limited. Their interactions limited to the inside of the clinic, generally between clients and staff. and like we talked about before, predominantly as a result of angst being expressed about not being able to take photography. That's one example, and that is translating into some, I would say, some elevated temperatures and some inappropriate behavior and some use of some terms that are abusive and hurtful. So we are monitoring that very closely. We actually sent Mike Leontic, who's a commander with Paramedic Services, serves as our director of clinic operations, fully engaged with Dr. Shavita Patty. He actually mobilized today and was going to meet with a number of clinic managers and staff, just to make sure that, of course, we fully understand the situation, that we're fully supporting our staff that are there, and paying particular attention to anything that we may need to change or anything we may need to do differently. At this point, the feedback to that has been no, other than to really just to reach out to all of our clients and everyone who is coming to a clinic to continue to be patient, be respectful, and understand that there are privacy expectations in the clinics, and that all of the hundreds of staff that are staffing those clinics, and all of our Team Toronto partner clinics for that matter, are working extremely hard under very demanding circumstances and are doing their very best to do that as quickly as possible. And we certainly appreciate everyone's patience and understanding.
Thank you very much, Chief. Final question is to Natalie Johnson from CTV News. Natalie, go ahead, please.
Hi, everyone. The data seems to indicate that the number of daily first doses are leveling off or even decreasing. Is it fair to say that we're seeing a plateau there on first doses, and are you concerned about it considering we're still looking at 30% of the population that doesn't yet have that first dose?
So, Natalie, when I look at our data, I'm still continuing to see a number of first doses being administered, and certainly not just us at Toronto Public Health, but all of our vaccine partners. We're working together to make sure that we're facilitating access to vaccines, lowering whatever barriers may be impeding people's ability to get vaccine, and thus far we've been seeing a good response to that. So we're continuing to work very hard to make sure that we're getting first and second doses, because we know how significant this is to, getting us to the other side of this pandemic.
So at what point then do you start being concerned about a leveling off of the first doses? Do you think that when you're at the 80% mark and you have 20% people who are unvaccinated, then you start to do more targeted outreach, or how does that work?
So, Natalie, I don't know that there is a specific figure. Our goal is to, where worry starts to set in, it's a question of, we just like to get as many people who are ready to get vaccinated, and we'd like to do that as quickly as possible. Whether it's through a mass immunization clinic, a pop-up, a hospital-based clinic, at a pharmacy, in a doctor's office. We are absolutely doing our level best to ensure that every available opportunity is open, that we're reducing barriers to the greatest extent possible, that we're facilitating access. And in fact, you've heard me say, I'm even asking the residents of Toronto, the people of Toronto, to actually have discussions with their family members, their friends, and their neighbors, and help them get access to vaccine if that's what's impeding their ability to get vaccine. So we're going to continue to push that out. We will continue to observe what our data show and adjust our actions in accordance with that, as we have throughout the entire pandemic.
Thank you, Dr. Davila. Thank you, Mayor Tory, and thank you all for joining us. That concludes today's briefing. Please stay well.